recording, I think. Okay, great. Hi, YouTubers, and anybody who is possibly looking into getting bariatric surgery, or maybe already has bariatric surgery, has had bariatric surgery. My name is Stephanie. I am actually due for my Roux-en-Y gastric bypass tomorrow. I'd meant to do this video like a lot sooner, but things get pretty crazy and I'm running around doing stuff at the last minute. There's just so much to do. I've been prepping for weeks. I guess basically, let's start by saying not everybody, but a lot of people do, I guess, their gastric bypass story or their weight loss story on YouTube, and I've seen a lot. I followed through like years of people, and I wanted to do my own mostly for me. I would like to see myself, and I know that the pounds are going to shed very quickly, and watching my videos is going to motivate me to see like how fluffy my face is and go, oh my god, you know, time to go outside and go jogging. But a little background on me is I am 26. I am a mother of an autistic child. His name is Dominic. He is 7. I spend a lot of time with Dominic and working on him and his therapies, and I've devoted basically my life to my son. I am married but separated, but not single. I guess it's one of those, it's a long story, it's complicated type of relationships with my husband, but I have been overweight all my life since I was 8 years old. I can remember having to go get bigger clothes, being made fun of. Oh God, everybody who was ever overweight has been made fun of, like, just horribly, brutally. I've gone up and down my whole life, just ballooned and lost and ballooned and lost. I think the smallest I've ever been out, you know, in adulthood, I was 18, and I think I got down to like, I was around 190, maybe 200 pounds, and I felt fabulous. And I've never gotten back down below that. I always gain, and I know psychologically, people who are overweight, due to eating issues, don't ever lose those issues. It stays with you for the rest of your life. So this is why gastric bypass surgery is so important. It's very, very useful, and I think that some people do need it, require it, in order to maintain good health, honestly. Mostly, I want this surgery to be healthy. Obviously, I want to look, you know, sexy and fabulous and whatnot, but I want to be able to keep up with my son. He is so crazy hyperactive, and I get winded just going up some stairs. So it's just, it's pretty pathetic, but I'm ready to not be that anymore. I have been trying to get gastric bypass surgery since November, which is my birth month, of 2012, and it is now July 2014. So I don't have any qualifying conditions except for the fact that I'm over 40 BMI. I have TRICARE, so it's a little different, I think, with like other insurance companies and things like that, because my husband's military. But I had to jump through just crazy hoops to get the surgery. It's insane. My highest weight, I'm sitting here like rambling on, but whatever. You're gonna get to know me by the end of this video. My highest weight was 336, and I think that was in like 2011, maybe 2011, which is when I got married to my husband, my husbro. When I went to my pre-op appointment, I stepped on a scale and I was 307, which was not good, trust me, because I had gotten down, what was it? I think it was in October or November of 2013, which doesn't even seem that long ago now, but I got back down to like 270 and I was feeling good. My face was like slender and I was excited, and I ballooned right back up again, like back to 300, and oh gosh, I was like 310, I think. So it's actually July 21st today. Oh my gosh, my surgery is tomorrow. I'm so excited. So since my pre-op appointment, July 7th, it's either the 3rd or 7th. Anyway, I started my 2-week diet before surgery on the 7th. 307. Today I am 283, which is super exciting. I'm so hungry. Just crazy diet. I was on Slim Fast mixed with water for breakfast, a sugar-free popsicle for a snack in between breakfast and lunch. For lunch, another Slim Fast mixed with water, and then sugar-free Jell-O in between lunch and dinner. And for dinner, I had less than 3 ounces of chicken and 2 cups of fibrous vegetables. So yeah, I've lost with 307 to 283. You do the math, because I'm not gonna. 25 pounds, I think, or something. Oh, that's probably wrong. Anyway, so basically, I really am preparing myself for the surgery to be as healthy as I possibly can be when it cuts me open. I've got stuff just posted all over my walls, like my hospital checklist, and then my clear liquid diet menu when I come home from the hospital, which is just crazy sick. You got to get them like 64 ounces, and with Roux-en-Y bypass surgery, your stomach's like 30 cc's. It's like the size of a golf ball. So okay, so I totally wrote some notes here. This video's gonna be crazy long. I'm so sorry. I wrote some notes here, and I guess they're kind of going to be all over the place. Wait, this says first video. I already talked about the liver shrinking diet that I'm on. Oh yeah, basically the diet shrinks your liver, because if you eat fatty crap, your liver gets like really hard and really difficult to maneuver, like literally hard, and then really difficult to maneuver because your liver overlaps part of your stomach inside your body. So when they go to do the surgery, your liver can like tear and all kind of nasty stuff, and that's just gross, and you should try to lose weight before your surgery anyway. What else? The diet should be about 2 weeks. Vitamins. I am taking so many vitamins right now. I am taking calcium twice a day, B12 twice a day. I am taking, well actually, okay, you're supposed to take, that's a lie, scratch that, that's not what I'm taking. I'm taking multivitamins twice a day. I'm taking B12 with multivitamins twice a day. So B12 and multivitamins go together. You can have those two together. And then I take iron separately because you have to take it separately. And then I take the calcitrate, the calcium citrate, 3 times actually a day, along with D3 3 times a day. And I take biotin for my hair and nails, and I take potassium, which is good for your heart. Not everybody needs potassium, but I notice that if I'm low on potassium, my heart will like, it'll flutter or it'll pump really weird, and I don't like the feeling. It feels like a panic attack kind of. So I take potassium. And I think that's it. Yeah, so those are all the vitamins. Multivitamin, B12, iron, calcium citrate, D3, yeah, and then the extra ones that I take, potassium and biotin. So, gosh, what else? Okay, for my surgery, let's see, apparently it's going to be really painful on the left-hand side because, and I'll stand up and show you my size and my weight and everything. A lot of people don't do that on their first video because they're like, oh, I'm so large, I don't want to show what I look like. I'm going to show it all, okay, because I'm going to be so excited losing weight. Anyway, okay, so they make, I believe it's 6 incisions, but they make an incision on the left side through muscle. So that one really, really smarts after surgery for quite a while. And you have to like change your dressings frequently because my son's standing over here. I'm waiting for him to jump in front of the camera. He's so narcissistic. There he goes. Hey, Boogie. Can you say hi? Come here. Say hi. Very good. That's an issue that a lot of people have, is that they don't change their dressing every other day or sooner, and they get infections. And also wash your ass after surgery, because a lot of people don't like bathe or clean until like after their post-surgery appointment. No. Like, you need to be, as soon as you get home, take a shower. Don't soak in anything. Don't soak in a bath or in a pool or anything crazy like that. But wash your ass, people, please. Because, ew. So when I wake up from surgery, I will not have anything to drink for 24 hours in case I'm leaking anywhere. So they will make me drink barium and then make sure I'm not leaking. And apparently after not having anything to drink for 24 hours, Dami, please don't baby. My lips are going to be dry and I'm just going to be really thirsty. So forgive him. Just bring chapstick to the hospital. I'll give you a list of stuff to bring. But anyway, the barium's going to taste absolutely fantastic for the first couple of chugs after not having anything to drink for 24 hours. But then it'll hit you when you're done with it. And so if you're good after you drink the barium and there's no leaks, I think you start on 1 ounce of water an hour, which is, oh, I can't find it. The size of those little medicine cups that go on top of like Tylenol and stuff, the kitty ones. Let's see. Really? Awesome. I thought I totally had more than this. Sweet. Okay. So, my surgeon basically told me that the requirements for leaving the hospital after those 2.5 days would be like, and by the way, you're going to have to get up and walk like right after surgery. They're like very careful about getting blood clots because they don't know how clogged your arteries are or if your arteries are clogged, which if, you know, you're heavy set, probably, they are. So, they're going to put you on blood thinners and they want to make sure you don't get any blood clots because that's just, you know, death. So, I mean, I don't want to scare anybody, but, you know, that's why I say I'm losing weight and being as healthy as I can before the surgery. Just walking constantly, in between resting. I guess when you get home, oh yeah, the requirements for leaving the hospital, I think my surgeon said 3 to 4 ounces of water in an hour, which is quite a bit, because, yeah, I think it's 4 ounces in an hour. And you have to be peeing and maybe passing gas. I'm not quite sure about the gas thing, but definitely you have to be able to pee. So when you get home, you basically are going to have to constantly be drinking. You have to sip very, very, very small amounts because you'll, like, if you take too big of a sip, you'll just throw it right back up. Your stomach will reject it completely. So have a puke garbage can just in case. Basically, my clear liquid diet menu starts at 8 a.m. and between 8 and 9 a.m. I have to drink 6 ounces of water. 9 to 10 a.m. protein water, which is Isopure. It's ISOPURE, I believe. I went to GNC and got it. They were on sale for like $2.70, but they are kind of expensive. They're like $5 a pop. So you don't need very many right after surgery. I just got 2 bottles. So anyway, 10 to 11 is 6 ounces of like a sports drink. They have the Powerade Zero, which has no sugar in it, no calories or anything like that. So that's what you need to drink. And then 11 to 12 p.m. I have 6 ounces of broth. And so basically just every hour you have to be getting in fluids. And it's supposed to be 4 to 6 ounces, but I'm pushing myself to 6 ounces because I really don't want to be dehydrated after surgery. Because here's the thing. If you think about it, you can't really skip taking in sips of water or whatever you're supposed to be you know, ingesting at that point, because you can't hurry up and sip. You can't gulp or else you'll throw it up. So if you get dehydrated, the only option you have is to go in the hospital and get stuck with an IV, you know? So I'm going to do what I'm supposed to do and drink my fluids. It's very essential. So the first 3 days home, 3 or 4 days, it's absolutely clear liquids. And then from there you do, oh, what are they calling it? I think it's like protein liquids or something. So like protein shakes, yogurt, I think pudding, I'm not sure. I don't remember. My list is in the kitchen up on the counter or on the cabinet, so it's not like in front of me. But stuff like split pea soup, and it has to be blended and then strained. Like you have to get a fine wire strainer, colander, whatever you call it, and then you can drink it. So, what else? I've gone through so much stuff. Hospital checklist. My checklist, it's not really too extensive. I remember I got a C-section with for my son, in 2007 when he was born. And I forgot to bring deodorant. Like, I was like, oh, you don't need anything for the hospital, really, you know? And anyway, so, like, when I went to go breastfeed him for the first time, I was like, oh my God. So, TMI, whatever. But bring deodorant, please, because you are going to smell funny. Bring your own pillow. Make sure that you have a unique cut. Make sure your pillowcase is not white, because then you'll mistake it for, like, you know, the hospital pillows, and then you will forget it. Lip gloss. I am going to use Vaseline because that's probably the best thing to use for your lips. Gas-X thin strips. I cannot stress enough how important these are going to be. After surgery, you are so full of air. You are so full of water that you're just going to be completely ridiculously bloated and uncomfortable. So please pick up a box of these. They're $3 and some change. I got it at the commissary for like less than $4. They probably have a generic brand at Walmart or something like that. Apparently those are going to be super important, so that's on my checklist. My phone and my phone charger. I take medications other than the vitamins, so my medication and my pill crusher, which is super important. If you've got vitamins that are not chewable, which they're all supposed to be like chewable or sublingual. Sublingual means it dissolves under your tongue. Get a pill crusher. They are so awesome. It's just basically like round, and it unscrews, and then you screw it closed and it crushes the pill. So super awesome. And then lotion, but I'm not sure if they're going to let me with the lotion because you're not really supposed to put anything topical on you because of like the scars and stuff. So I'm probably just going to do my legs and arms. Or the scars, I mean the incisions. Okay, now, I am actually at the point, it is 2:21, I'm running late. I'm actually at the point where I am no longer to eat any more food, no longer allowed to eat any more food. I had a Slim Fast water shake for breakfast, and then I had a sugar-free popsicle. In between then, I'm sorry, I'm just not looking forward to this. Okay, people, I have never seen anybody do a video about this. I cannot stress enough how disgusting this is, but pretty much I can't imagine that no doctor would not give you this, but I don't even know if I sound right now. Sorry. Anyway, I had to drink magnesium citrate. I don't know if you know what it is, but pause the video and search engine. Basically, this is going to get rid of everything inside me. Enough said. I'm not looking forward to it because apparently it tastes gross too. But I chilled it in the refrigerator, so it's cold. Totally going to drink it in front of you. Be very well hydrated before you drink this shit. Okay, and try to get in as much water as you can. It's going to be difficult because you're going to be like in the bathroom, in the kitchen, in the bathroom, in the kitchen. But, and I'm sorry, I have like this HD Microsoft camera, so it constantly is like zooming in and out. Well, it's focusing is what it's doing, but it's really fucking annoying because I go, freaking annoying because it goes fuzzy or whatever. So do I have anything else to tell you? I don't think so. At this time, I don't. It's just super important to take all those vitamins before your surgery because I don't think you can take them right after surgery. I think you have to wait a few days or a week or something like that. Oh, yeah. Okay. Really quick, because I do have to drink my stuff. Okay, when I went to my pre-op appointment, they basically made me sign all this stuff that said what the risks for surgery are. And I'm going to list them. And this is not to scare people, it's to wake people up. Because if you're the type of person, which, not to be funny, but I'm going to say about 60% of the people that I've watched on this freaking YouTube channel don't even exercise, and it pisses me off. I get in almost 2 miles about 4.5, 5 times a week. People don't exercise, and I know that I can lose all my weight, all of my excess body fat in 4.5 to 5 months doing it the way it's supposed to be done, which is 60 to 80 grams of protein a day, taking all your vitamins, getting in all the fluids you're supposed to get in, and exercising. It's a real life change. It's not get the surgery and then you'll lose all the weight. Yes, that does happen. Not gonna lie. If you do absolutely nothing, you're gonna lose all the weight anyway. It will take longer, number one. But if that's you, the surgery is not for you. It's really not. It's just not. You're gonna have a hard time with it if you're not ready to make the entire lifestyle change, because you have to weigh your food from now on, portion control like a mother lover. You're eating basically what's inside of a pudding cup. That's the size you're eating from now on, when you actually get to eating regular solid foods. Solid foods. That's after 5, 6, maybe 6, 7 weeks after surgery. So when you can eat like regular solid foods. You can't have bread, rice for an entire year. This is serious. This is really serious. This is for people who are willing to make the lifestyle change. Sorry, I'm really passionate about it because people are so freaking lazy. And I'm lazy too, but I'm the type of lazy like, oh, I don't want to clean the kitchen. Let's watch 30 minutes of Netflix real quick. That's my lazy, not like, anyway, whatever. Okay, so the consent for treatment / procedure for laparoscopic gastric bypass surgery is 1, death, leakage, blood clots, infection, bleeding, need for drugs, ulceration, stenosis, which means you have like a narrowing of your esophagus. Where'd I go? Bowel obstruction, disruption of incision, injury, just like all the above. Anemia, dumping syndrome. Dumping syndrome. Okay. This is why I am getting ruined wide. I'm not going to lie. Like I said, psychologically, these issues don't ever go away. So basically, let's say you decide to have, what's tasty? What do I want? A loaded potato skin. You know, like they cut the potato, gut it, and like put in like cheese and bacon. Let's say you eat one of those. You are going to shit your brains out and probably end up throwing up and convulsing for, I think they said like 6 to 8 hours. So have fun with that. If you want to cheat, that's what's in it for you. Dumping syndrome, pretty self-explanatory. Hernia, respiratory complications, removal of spleen, heart attack, stroke, protein deficiency, allergic reactions, anesthetic complications, loss of bodily function, transfusion risks, hair loss, vitamin and mineral. There may be decreased intake and absorption of vitamins and minerals leading to anemia, nerve damage, neuropsychiatric disorders, bone loss. There you go. Complications of pregnancy, skin problems, depression, kidney stones, gallbladder disease, laparoscopic risks, pancreatitis, and other complications. Nausea, vomiting, hypoglycemia. Hypoglycemia. If you don't get in the sugars and stuff that you're supposed to, and you just give yourself sugar-free, 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 you can become hypoglycemic. Your blood sugar will drop down to like 40, 30, and you can go to a coma and die. So, hold on, my husband. Hello? 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 Okay, so he pocket dialed me. That's all good. So take care of yourself, people. Do it right, because this is a fight. This video is getting way too long. So, basically, I have to drink this now. I can't just not drink it. Oh my god, it's freaking bubbly. It said when I opened it. I don't know if the sound is going to be good on this. I just realized I have a giant box fan, like, blowing in this direction. I live in Colorado, so it's hot right now outside. There's no AC here. Like, nobody has AC. Originally, I'm from Florida. I've been here for like a little over a year now. Whoa, when I came here and there was no AC, I was like, I'm gonna die. That makes no sense. Oh, it smells like doo-doo. Not really. It smells lemony. Here we go. Okay. Oh, excuse me. I'm sorry. That was really disgusting. Okay. I would actually point out that that wasn't too bad. It's lemon flavored. And it was really bubbly like a soda. So that was the last soda I'm going to have for a really long time. I know my stomach's really full. And I'm probably going to shoot my brains out. Holy cow. Okay. This is pretty much like my last step for getting ready for surgery. So, I am so excited, people. I cannot even tell you. I've been waiting so long and working so very hard for this. I guess that's it. I'm probably going to end this video. It's really too long, but I am going to take another video right before my surgery, most definitely, because I'm going to be freaking out. I mean, I asked today at the doctor's, the general surgery clinic on base, and I was like, you know, how many people have died from the surgery? And she said, we haven't had one death. And I was like, come on, son. Come on, son. And she was like, no, we really haven't had any death from surgery. She said, now, my husband texted me, sorry. She said that, that somebody 2 years post-op, which means they had their surgery 2 years already, had killed himself, which I can't really imagine, but that is when I understood why I had to jump through so many hoops to get the surgery through TRICARE. Just, I can't even tell you, I had 3 I had 3 evaluations. What's the word? Psychiatric evaluation. Thank you. Sorry. I'm totally brain farted. It's the magnesium citrate. We're going to blame it. It's just been so crazy. I had to do like 6 months of UAs, urine tests, because I was smoking marijuana. But at least I told them I was honest. They were like, do you do drugs? And I was like, yes. I smoke a lot of pot. But I don't anymore. I guess basically that's it. I mean, the only other thing is they were telling me that a lot of complications is people will get their surgical site infections and or become very dehydrated and have to come back to the hospital. So listen, people, do it right. I guess that's it. Just anybody who's watching this, I'm so sorry that it's so long. My videos are probably mostly going to be pretty long. I'm a talker. And I'm a little nervous. So anybody who's watching, hi, and if you have any questions or comments or advice, that'd be great. There's still so much to go over. It's crazy. Like, there's still so much. Anyway, I will let y'all go. Have a great day. Thanks for listening. Bye.